Okay. Okay, I think it's time to start. Good afternoon, ladies and gentlemen, respectively good morning or good night, wherever you are globally. I hope that you're all doing well and had no problems in connecting with this virtual panel discussion, which is co-organized by socialprotection.org with the German Development Institute, DIE in Bonn, and the Bonn Rhein-Sieg University of Applied Science. My name is Markus Loewe. I'm research team leader for the Middle East and North Africa region at the German Development Institute, DIE in Bonn, and senior researcher since 1999 with responsibility for social protection. Well, today, my dear friend and colleague Esther and I are officially launching the Handbook on Social Protection Systems, which we have edited over the last 3 years with Edward Olger. The handbook deals with all issues relevant for social protection, but it has also a bit of a focus on system building and social protection policies. Therefore, we would like to take the opportunity of today's event to have a discussion virtually on the question, what makes a social protection system? Of course, at the end of this virtual event, we will also present our handbook. I remember well when Esther and I decided to start the whole process. We were meeting with a beautiful view over River Rhine in Bonn, and we were driven by 2 issues that were moving us. First, we had both felt hard in our work, in research, in training, in policy advice, that there was no useful overview or introductory reading for researchers or policymakers looking on social protection globally, including the global north and the global south. And not even a textbook for students that would help them get into the topic. The second thing was that, and we decided to fill this gap by producing an introductory book. Second, there was a lot of talk at that time. Admittedly, there still is, but at that time it was quite new. Talk on system building and social protection. However, our feeling was that many of those who talked about it were not really clear what they meant and what they had in mind, what the word actually meant. So we thought that it might be important to really look at this buzzword and produce a book that looks into the question, what makes a social protection system? When is a social protection system based on a systems approach? And that is very much the question of today. So we have in mind to discuss some of the following questions and perhaps even more. What is a systems approach in social protection policies? What does it take to move from a set of individual social protection programs in a country to a systems approach? Which social protection programs can and should be combined, and how can different programs best be coordinated and harmonized with each other? So, and I would like to really encourage all of you who are listening to this event to participate in the discussion. Bring in your opinions, your questions, your experience. If you have any comment or question on the topic or on the handbook itself, please do type it in the chat function of Zoom. We will take up your contributions during the second half of the discussion round. At this point, I really do not want to forget taking the opportunity to thank socialprotection.org for providing us with the possibility to hold this discussion and launch the handbook through their weekly series of wonderful webinars. Now I would like to introduce to you Professor Esther Schüring, who will chair the virtual discussion. Esther is Professor of Social Protection Systems in the Department of Social Policy and Social Security Studies at Bonn Rhein-Sieg University of Applied Sciences. And she's also the academic head of a wonderful international master's program on social protection at Bonn Rhein-Sieg University. Her main research interests are eliciting public preferences in social policy and in studying the role, acceptance, and effects of targeting and conditionality in social protection design. So, please, Esther, most welcome. The floor is yours.
All right. Thank you very much, Markus, for setting the stage for today's event. And of course, we are not doing the event just by ourselves, but we've invited 4 distinguished speakers. And we also hope that basically all 4 will be present. Right now, we only have 3 here, but we hope that the 4th one will join over the course of the online event. So whom do we have here? We have Chris de Neubourg, who has a long history in social protection and who is a professor at Tilburg University and a director of social policy of the Social Policy Research Institute. We have Veronika Wodsak, who is a social protection policy specialist at the ILO, and Garima Bhalla, who is an economist and also a social protection specialist at the FAO. And we're still waiting for Benson Chisanga, who is a lecturer at the University of Zambia. So while the 4 actually work for different organizations in different country contexts, they also have at least 3 important things in common. The first one, obviously, is that they're all experts in social protection. They have dealt with questions relating to system building as academics, policy advisors, or critical observers. Secondly, they all have a history in academia as well as a history in more practically oriented policy advice. And last but not least, they have all contributed to the Handbook on Social Protection Systems with very interesting chapters. So Chris, he has written a chapter on the systematic approaches to social protection. And he argues in this chapter that social protection instruments don't easily and just naturally chain up, that social protection instruments can be complements, but of course they can also be substitutes. And while the choice and combination of these various instruments can and should be guided by technical advice, decisions ultimately still remain normative. He discusses 4 different prototypes of social protection systems: the 100% social protection coverage model, the social protection floor, the universal basic income model, and the social safety nets approach. Veronika, she has authored a chapter on coordination of different instruments. And she argues that while universal social protection should be the overarching goal of every social protection systems, ways to achieve this goal can be manifold and depend on political, economic, cultural, social circumstances, preferences, but also legacies. And when coordinating, the chapter points out that it's not only important to focus on the internal coherence of programs within the social protection system, but that social protection also needs to be externally coordinated with other policy measures. Garima, she has written a chapter on the effects of social protection on economic development. And she discusses how, among other things, how impact can also be maximized. And one way of doing so, of maximizing impact, is through the combination of different programs in a meaningful way so that they respond to multiple constraints at the same time. Another nice feature of this chapter is also that it's quite critical also of what the combination of interventions entails actually at country level and whether countries are in a position to manage. And the chapter also puts social protection into the wider policy context when it comes to promoting economic growth. So you can see that we have a really nice panel, and we hope that, as I said, Benson will join. He has written 2 case studies on Zambia, so he's actually supposed to bring in the country's perspective. And he's written the 2 case studies on the evolution of cash transfers in Zambia, the challenges that are related to it, and also possible measures how to move towards a more systematic approach to social protection, and another case study on capacity building measures that are called for in the country to have well-qualified staff at different levels. All right, then let's start with the interesting part, of course, the questions. And of course, we also want to invite you to share your questions to the speakers. So there'll be 2 question rounds that we will do up front, and then we open up the floor to your questions as well. So please type in your questions into the Q&A box, state your name and organization, and if you're addressing the question to a specific speaker, please mention that as well. And of course, you're also invited to interact with us on Twitter using hashtag #SPORG-webinar. All right, coming to our first question round. And I can see that Benson has joined, fantastic. So we also have the country's perspective included. So my first question actually goes to Veronika. You're working for the ILO, and the ILO, of course, has advised many different countries on a systems-based approach to social protection. And I wanted to ask you, why has this actually been a priority for the ILO? And what are for you some of the key features actually of such a systems-based approach? I think you're still muted.
Thanks, Esther. Yeah, indeed. Why this, at the ILO, we very strongly argue for a systems approach to social protection. Why social protection is a human right. We also say it's a social, economic, and political necessity. It's at the heart of the SDGs and the 2030 Agenda for Sustainable Development. And we firmly believe that only a system or systematic approach can enable us to achieve progress towards the SDGs and achieve progress in realizing the human right to social protection. And the key features, I would argue there are at least 4 key features of a systems approach. First of all, a systems approach to social protection needs to be rights-based. It needs a strong legal framework. First of all, because it's not ad hoc measures. It's a systems approach that needs to be institutionally anchored across electoral cycles, across governments and administrations, and a rights-based approach guarantees this. Also, a rights-based approach creates entitlements for the population and obligations to fulfill for the state. And this allows then citizens to hold the state accountable also, and this is important. The second element I would argue is to have a comprehensive life cycle approach. You don't have a social protection system if you have some, I don't know, social pension here and then a social assistance benefit for the extremely poor there. But it's really, you have a system approach if you systematically look at across the life cycle, family benefits, maternity, disability, employment injury, unemployment, old age, health, and you address all those life cycle risks systematically. Thirdly, for a systems approach, and this goes together with what I said before about a rights-based approach, a system approach means that you build in sustainability, and not just in terms of the financing. Of course, you need sustainable financing, but also in terms of the delivery structures, in terms of the governance that you put in place. So this also means complaint and appeals mechanisms, inbuilt mechanisms to adapt the system to demographic evolution, to economic developments, to new forms of work and different types of new types of employment relationships. Also very important for sustainability, mobilizing support in the population, creating awareness, building a social protection culture in the country, that people are willing to pay contributions, they understand why they're asked to pay contributions, and they also see the benefit in managing their life cycle risks through the social protection system. And then finally, and this is also, as you rightly introduced in the beginning, what we talk a lot about in our chapter on coordination, every system has elements that relate to each other in terms of coordination, and it has boundaries, and it interacts with its environment. So it's important also that the social protection system then is coherent with other relevant policy areas in health and education, but most importantly also employment policies and areas. And so I would argue those four elements, a rights-based approach, the life cycle approach, building sustainability, and ensuring coordination and interaction with the environment are important features of building a social protection system.
All right, thank you very much, Veronika, for highlighting in particular also these four features, and I think also for introducing the social protection culture, which I think very often gets forgotten also when people talk about sustainability. So over to you, Garima. Would you actually agree with those four features that Veronika mentioned? Would you add any? And maybe can you also take it, let's say, down to the practical level and give us an example of maybe a country that has done a fantastic job in terms of system building, or a good job in terms of system building, and highlight a bit also what the factors of success were.
Sure. Thanks, Esther. Yes, no, I agree with Veronika. I think the four features that she highlighted are very pertinent, and I completely agree with the way she's sort of described and explained them. I mean, of course, in terms of addition, you could add nitty-gritties, but I think the central sort of principles are captured very well by these four. Now, you're asking for an example of a best case example of a country that has progressed. You know, in my mind, when I think about systems, I think the issue is not so much in terms of progressing from like one particular social protection intervention to a bundle of these interventions, right? So it's really more about how functional the system is in its entirety along key dimensions of inclusiveness, responsiveness, or effectiveness. And I can think of like two categories of countries when thinking about how they've evolved their social protection systems. Now, on one hand, you can think about some low-income countries, which initially started out with a small set of schemes covering a tiny formal sector and a patchwork perhaps of externally or partly externally financed programs. And what we've seen is that in these countries in the last couple of decades, they've really started to build a social protection system. And typically one fulcrum point is when a national social protection strategy is drafted. And what is key over here is the social dialogue that occurs when that happens between the key stakeholders. So Veronika mentioned, making sure that it's coherent across the different key partners related to health, education, employment, agriculture is another key partner. And we've seen a lot of these countries establish these social protection policies in the last decade, last 10, 15 years. Kenya, Mozambique, Rwanda, Lesotho. Another pivotal moment that happens is when a lot of these programs switch from an externally funded or a partly externally funded mechanism to domestically financed, completely domestically financed flagship national social protection programs. And yet another sort of pivotal point, I would say, is having a comprehensive social registry in place. So these are all sort of steps that we have seen a lot of countries take in order to progress towards a systems approach. The rights-based approach that Veronika mentioned is, of course, extremely important as well. Now, one thing I would say in terms of an example, and another category of countries that we see, which range from low to even high income countries, is that a system has been in place for a while, but it's often been developed in a sort of a haphazard manner with lots of sort of fragmentation and duplication gaps. Now, adopting a systems approach in those cases basically means plugging those holes, reducing the duplication, reducing the fragmentation, and promoting greater coordination and articulation. one best practice example, I mean, I could give over here is, of course, the famous Bolsa Familia program of Brazil. If you look at its history, that in 2002, the country actually had 3 cash transfer programs, and it was felt at that moment that all programs should be continued, but they should be unified. And so they combined these programs and they created the Bolsa Familia. But it was, the transition was tough, because prior to that, you had different ministries with different databases, with different eligibility criteria. And all of them had to sort of came together in the Bolsa Familia program. Another key feature I would like to highlight of this program is that it was integrated with the Brazil Without Poverty plan, which was organized along 3 key axes. So yes, an income guarantee, access to public services, of course, but also productive inclusion. So it's a successful example in 2 ways from a systems point of view. One is that even currently, it's highly dependent on multiple sectors, as it requires the coordination of education, health, sanitation, and economic development services. And then second, it's effective. In the second way it was successful is that it was effective, that it did lead to a significant reduction in poverty. Of course, not all of the reduction in poverty that occurred in Brazil back then has been due to Bolsa, but it's also been due to other productive inclusion programs. But the Bolsa Familia has also played an important role. So the systems approach then is not just about moving from a continuum, from a single program to a bundle of different programs, but it's about incorporating the different elements that Veronika laid out. So making sure that the sort of package of social protection programs that exist within a country are comprehensive. They cover a multiplicity of risks and categories of people, that it's equitable, it's coherent, and it's right-based. Thanks.
All right, thank you very much. And also, I think the example really highlights quite nicely sort of the merits, but also some of the challenges. We'll get to the challenges in greater detail at a later stage as well. So you talked quite a bit also about the setting of low-income countries, middle-income countries. Let's turn to the high-income countries as well and see whether we observe a continuum in this context. So over to you, Chris. What would you say, what is the situation in the global north? What can potentially also the global south in that sense learn? And which mistakes should definitely not be repeated?
Thank you very much, Esther. I think that the global south, if we can call it that way, should not learn too much from the global north. We took about 180 years to transform our social protection instruments into a system. They can do it in 10 years or even in a couple of years. And so they do actually, in that sense, a much better job than we did, because we in the North, it was developed from a social protection right for one particular profession, for illness, and later on for pregnancy, and then and so on. And it was developed into like a map of many, many different things. And then later on, only when it came to the first economic crisis, actually after the Second World War, in the 70s and the 80s, all these countries were forced to rethink what we were doing there. And that was a first incentive to reorganize the system. If you look at the systems now, well, first of all, the global north in social protection doesn't exist. I mean, you have countries in Europe which have a completely different system compared to Canada or to the United States. And even between Canada and the United States, there are huge differences. Just think about the health system, how that is different in the two countries. So you cannot talk about the global north. But if you think, and I would like to follow up on what the previous speaker said, on what Veronika and Garima said, is that yes, a life cycle approach is vital. A rights-based approach is vital. Also, that we learned in the global north over the years, and we now know that it will have to be implemented that way in low and middle-income countries. But I think also the thinking, culture, the social protection culture, I like that word, Veronika, is that should be there, is the thinking that actually everybody can be at risk. And recent 1.5 years has learned us that across the globe, everybody, nearly everybody, there's 1% of the population that's never going to be at risk, I think. But 99% of the population can be at risk at any time. And that's actually the basis for thinking about social protection, about protection that is given by your community, your country, your region, or even across the globe to protect you against these risks. The sustainability of a system is tested under stress. And stress we had over the last 1.5 years with the COVID pandemic being having consequences all over the world in all our countries. And if we studied a lot of differences between how countries reacted in social protection terms. And there is one thing that come to mind. Okay, there are many things that we got out of the research, but one thing that for me was very important, and that's simplicity. It's very difficult to build complicated systems. If you don't believe me, talk to your IT guys in your government or your university or whatever. These people always try to think in very complicated systems, comprehensively taking everything. If you try to do that, then you end up like the countries that Esther was referring to, countries having like hundreds and literally hundreds of social protection instruments, which are all over the place and will never get into a system unless you force it into a system. And let me give you 2 examples of this simplicity, how this can be done. One from the high income country and one from a low income country. The simplicity of your social protection system, if there is, for example, a temporary work or a temporary unemployment law, like there was and there is in many of our countries in Europe, and even in the US, there is an instrument like that, then you can expand that easily if you have enough money to cover the bill. And that's actually what all our countries did. I think the example of Mongolia is a lot more inspiring, I think. What Mongolia did is they used to have 10 years ago a universal child benefit and a social pension, a universal social pension. The universal child benefit was more or less deconstructed by the World Bank and the IMF when there was a cold crisis in Mongolia. But the registers existed. The register of all the children, not social registries, civil registries. All the citizens are registered. And so they increased the child benefit from 20,000 tugrik to 100,000 tugrik at once. And they made it from poverty targeted to universal. All the children got it. They did the same with the social pension. They knew all their pensioners. There was the registry of everybody older than 60, and they doubled the social pension at once. And so that's a very simple way to deal with the crisis. And it tells you something about how well or relatively well organized systems can respond to crisis and contribute to sustainability on the long term. I keep it here, Esther. Thank you.
All right. Thank you very much. Also, I think for highlighting one more time, first of all, the importance of data and simplicity, and also I think for shedding some light that some countries in the global south, if we can term it this way, were also much more exemplary when it came to responding fast to crisis, etc. I think in Germany we could have learned some lessons about this as well. All right, traveling back to Zambia. Welcome, Benson. I wanted to ask you to maybe describe the situation in Zambia. Is the system sufficiently simplistic? How would you rate Zambia's social protection system or strategy in terms of how systemic or systematic or systems-based it is?
Thanks so much for this opportunity. With regard to the first issue, I would say that currently in the field of social protection. One of the most important development over the last 5 years or so has been the formulation of a national social protection policy in 2014. Before that, there was no such explicit national social protection policy. And apparently, this was partly a response to the ILO 0202 recommendation of 2012, requiring member states to put in place some kind of social protection clause as the basis for the creation of maybe a comprehensive welfare state. So the Zambian government responded to that. But at the same time, they also recognized the issues going on at the global level in terms of how do we shape the social protection sector. And when I was looking at the document, social protection policy document, I came across a recognition of the work of Duvario and Sabatis Willa on their concept of transformative approach to social protection service provision, where they emphasize on issues to do with the creation of a comprehensive integrated system of social protection services. So there has been a recognition of that. And then based on those issues, they recommended or they articulated 4 major social protection pillars, which includes the social assistance, which covers people that are, incapacitated, people that are more vulnerable, that are living in extreme level of poverty, people that cannot be able to work. And the other program was social security program. This includes the contributor-based programs, such as pension schemes, public and private health insurance schemes, injury compensation schemes, and of course, a wide range of labor-based benefit for workers. The third pillar was the livelihood and empowerment. And this was going to focus on individuals and families that are not necessarily incapacitated, but that are kind of working, or sometimes you may want to define them as the working poor, that are working, but they are still below the poverty level. So they needed to create programs and services that are going to improve their livelihood so that they can be able to move above poverty levels. And the last one was to do the protection. And this was going to take care of some of the victims of various vices, such as the gender-based violence, victims of human trafficking, and people that are living with disabilities, that are vulnerable to abuse, etc., etc. So that's what has been the scope of what the social protection sector is advocating. So I feel that in addition to this, what this policy document has done is for the first time to reconstitute what is social protection as one of the important national social sectors. Before that, there were individual programs that scattered around and they were defined differently. But this policy document was to try to reorganize all these programs together and put them a label, social protection, and then define them as one of the distinct social sectors, in addition to other social sectors such as education, health, etc. So I think for me, for now, for Zambia, that has been one of the most important developments. With regard to how then can I rate Zambia in terms of developing the social protection sector, if you look at some of the attributes that have been articulated here by ILO and others, I want to mention just a few of them. The idea of rights-based approach, it means that people should be entitled as part of citizenship, of course. And the other one is to do with sustainability, it's a sustainable system. Yes, that means that it's something that can be continuously provided. and using the concept of a cross lifespan, that people should be able to access those kind of program and service along their lifespan. And the other concept I found interesting was the concept of universalism. That means that, you know, moving forward, the system such a way that everybody should be covered. And then, of course, the idea of that it has to be well coordinated, something that's very integrated. If I'm going to look at, if I look at those attributes of what a system is, then I would say Zambia, we are not yet there. We are not there for valid reasons. And I'm not saying that we may not get there, but at the present time, I don't think we are able to evolve a system that can have those kind of characteristics for various reasons. And one of those reasons is that currently we don't seem to have adequate social protection legal framework. Because if you are talking about universal coverage, you are talking about sustainability of services. There is an assumption behind that there is a comprehensive legal backup, which tend to ensure that those kind of approach to service provision are guaranteed. But at the moment in Zambia, we don't seem to have a very explicit social protection legislation. What we have at the moment are individual programs within the social protection sector have some kind of legal backup programs or legal backups. For instance, we're looking at the contributory-based programs, the pension scheme, the health insurance scheme, worker compensation scheme, blah, blah, blah. Those kind of programs, they already have some kind of a legal registration that guide how they operate. But not all, especially when you look at the non-contributory programs, the social assistance program, livelihood and empowerment and protection. There isn't no such legal backup. What is there is what may be called statutory instruments, which are, you know, generated by the executive to facilitate provision. But it's not part of the overall national legal framework. That means that as a statutory instrument, it means that it can be withdrawn at any time. Or when there's a change of government, as we have now, we don't know what the new government is going to look. They are already looking at some of this program, and they may end up making some changes which may not be in the interest of moving forward. So this is the situation we have. So until we have a very comprehensive national legal framework in which this social protection sector can be operated, I don't see us really. As a matter of fact, I was told that in fact there has been some advocacy work in this area by non-state actors and cooperating partners trying to entice government to come up with a comprehensive national registration for social protection. And the draft has been made for the last 2 years, but the government has not taken that draft to Parliament so that it can be debated and approved. So, and we don't know why it has taken so long for the government to take such a registration to Parliament. But there's an advocate work in that area. There's so many reasons why, speculatively, that the government is concerned about. Once this becomes a legal binding, it will be difficult, given the economic scenario, how are you going to make sure that you have universal provision when the economy may not be able to sustain that level of provision? So that's one important challenge we have, inadequate legal framework. The other one, of course, is to do with inadequate institutional coordination. I know one of the attributes that of a comprehensive system that have been alluded to is the idea of a well-coordinated system, implying that various actors who are involved in this particular sector should be able to know what's going on and able to exchange information, blah, 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 blah. For now, we don't seem to have that level of coordination among various stakeholders. There seems to be, as of now, operating in situ. And what is so interesting is that if you look at one particular ministry, that is one of the key ministry in the social protection sector, we call it Ministry of Community Development and Social Welfare. There are two departments in that ministry. One department is social welfare, and this department is responsible for the social assistance programs and services. Okay, they're taking care of people that are more vulnerable, those people who are incapable to work and stuff like that. Then the Department of Community Development is responsible for livelihood and empowerment-based social protection services. Even within that ministry, the level of coordination isn't much to talk about. And so then again, you can explorate that in terms of other ministries that are involved. For instance, the contributor-based social protection program and services are coordinated by the Ministry of Labor and Social Security. And so again, to what extent do they that ministry coordinate with the Ministry of Community is a bit of a challenge. So that's issue about coordination need to be sorted out before you even start to think about a comprehensive or systematic way of looking at it. The other problem is to do with the inadequate social protection management information system. We just been told that from what I've just heard that to have an integrated social protection system, you need to have some kind of adequate information system of sharing information. Okay, so that various stakeholders as well as the beneficiaries know where to go, where to do, and it also helps for those workers that are involved in issues of case management, making referrals and stuff like that. They need to have access to a very comprehensive information base. At the moment, in Zambia, we are not yet able to develop that comprehensive national registry system of social protection in terms of programs and in terms of beneficiaries. So it's difficult for one to say, where can I get information about beneficiaries who are getting what kind of services? That's for now is difficult to find. So that's another major problem that actually is hindering the concept of systems approach. The other problem to do with management capacity, national management capacity. Okay, there are issues to do with the human resource in this sector. The numbers are not adequate, and there's some historical factors for this. The turnover of staff is very high for various reasons, either because of low remunerations, and so people are always in and out. The other is to do with the level of knowledge and skills in the social protection sector. We don't have at the moment. We are, for instance, in a recent survey we made about, people in the social protection sector in terms of levels of education. We only have a very few people that have specialty training in social protection. But what we have are people that are trained as economists, trained as insurance staff, and trained as social workers, trained as community development workers, trained as sociologists that are managing this. But in terms of the level of knowledge with regard to social protection, assuming social protection can be a specialized field of training, we don't have that. We are very few that have got special training in social protection. And most of these people are working in the multilateral organizations and the bilateral organizations and stuff like that, but in the core ministries that are responsible for managing the social protection at the national level, we don't seem to have that. Apparently, this problem has already been identified by government and the cooperating partners, that they did some 3 years ago, instituted some kind of research to see the possibility of introducing pre-service specialty training in social protection. At the moment, we didn't have, before that we didn't have, but the University of Zambia has managed to introduce the pre-service special training social protection. And this is again designed to kind of trying to build up the national capacity in terms of managing the social training program. So we have a program at undergraduate level and also at graduate level. So that probably may go a long way, but still more, there is a long haul to fill when we're talking about the national capacity. Then lastly, I can just talk about, there's so many issues.
I can see there's so many challenges and we could probably fill an entire hour.
Thank you.
All right, thank you, Benson, for those insights. And now we can see, let's say, all the requirements that we have, what we expect of a social protection system, that it should be have all these characteristics, should be rights-based, it should be coherent, it should sort of be accepted by a broad part of the population. So we have all these ideas of what it should be, and then we of course see the challenges on the ground. And then of course now the question comes, okay, so how do we actually bring the two together, and how do we ensure that also countries are on a path towards a system building? And in the interest of time, I would just ask the panelists maybe to give each of you a brief recommendation of what you think is key central. And I know we cannot give blueprints now to all the countries, but regarding the challenges, I mean, where would you start? What would you prioritize as the next steps? Starting maybe with Garima.
Sure, I can go first. Now, I think Benson has really taken us through a very sort of important and detailed list of the challenges. No, one other challenge that I would add to the list, if I can, and then I can probably give some suggestions also of how to deal with it, is of course this challenge related to the mindset. So what we see is when we are working with social protection practitioners, we find that changing the mindset is one of the biggest challenge for making the system a system and making it more coherent. So the mindset is basically that social protection is going beyond safety nets, and the realization that the people, even the very poor people, can make contributions and can make economic contributions. So contributions to economic growth, and importantly, inclusive economic growth. Again, I go back to the fact that social protection is not functioning in isolation. It's taking place within a larger context of structural changes in the economy, within the context of rural transformation. So what becomes very important is that, yes, there needs to be internal coherence. So back to what Chris was saying, simplifying it. Also external coherence, so not just about programs within the system, but also programs that are in other policy areas, but interacting with social protection programs, right? So what can we do about it? I think it's a tough question. I think, one thing that we have seen work is building coalitions of stakeholders to develop the shared vision and call to action. So building these coalitions across the relevant ministries, I think that helps. I think generating and disseminating evidence also helps. Of course, identifying leaders, policy champions, and seizing those windows of opportunity when they appear, that's also imperative. So that's one thing that I would highlight. The second issue that I would highlight, if I can, Esther, I'll just wind up in the next 30 seconds, because I think it's very important, is around what, again, Benson was mentioning on capacity issues, right? So a lot of time, what we've seen is that it's fairly easy to get these national level strategies documented, relatively easy, I should say, both for social protection and for other related ministries. But the rubber really hits the road at the local, at the ground level. So building these capacity for both frontline managers and frontline workers is essential. I think that sometimes is just often mentioned, oh yes, it's a requirement, but then action doesn't follow the recognition that it's a requirement. And oftentimes we find that these positions are often left vacant, or these frontline workers are overburdened. And these are the workers who are actually interfacing at a given point in time with multiple different programs and making these basic social services available to the people. So I'll just mention these two in the interest of time and stop there. Thanks.
All right, thank you. Yeah, Veronika, your 1 minute piece of advice on, like, if you look at the situation in Zambia, where would you start? I mean, in terms of all the challenges.
I mean, this is super difficult. I think one message I want to bring is it doesn't really matter where you start. It doesn't matter whether you start with the children or the elderly or the disabled. It doesn't matter whether you start with social insurance or social assistance, or it doesn't matter. I mean, I don't think it matters so much what you start with, as long as you make sure you don't promise something that you can't deliver, because that is absolutely crucial to build trust. And so go piecemeal, have a vision, and then build step by step. And start with something that unites rather than segregates. And this is culturally very different in every country. But in most societies, people won't argue against benefits for persons with disability, for example. Also, of course, this is always very tricky about this. I mean, deserving poor, or I mean, who does and who doesn't. But usually you will be able to identify certain things that there will be a fairly large consensus in society that this is something we can easily agree on is a good thing. And secondly, I very much like Garima's point about mindsets, and I really want to emphasize this very strongly. I mean, this comes back to also what I said about not seeing this as handouts or charity, but seeing this as entitlements. That's one mindset change. And secondly, considering it as an investment and not as a cost. It's an investment that has a return. It has a return in terms of more productive and healthier workers. It has a return in terms of reduced inequality and better social cohesion. I mean, the UN now talks about the new social contract. This is, I mean, social protection really is a key part in uniting and rebuilding the social cohesion that we need. And the pandemic obviously has exacerbated a lot of these like social conflicts or inequalities. So this is really, really important. And also, I mean, we're now carrying out research on economic multiplier effects, and Garima made that point also. It has a return, a social return, but it also even has an economic return. And so this is another mindset change that is really important, that it's not just a cost, and it's an investment, and it's needed just as much as roads and electricity.
All right. Thank you very much. I think this was important. Also a piece of advice that in a way it doesn't matter really necessarily where you start, but that there should be a sort of a systematic approach to how you progress. Chris, maybe any short statements before we open the floor. You mentioned simplicity. So is it really, if you're looking at the situation in Zambia, is it sort of a good idea to actually start sort of interlinking, combining programs, etc., all at once? Or what would be your piece of advice?
I'm not sure, but some time ago I've been to Zambia and looked at the social protection system. So I'm not sure that I'm really well informed enough to answer that question. But in general, I think institutions you can save costs if you want to convince people that they will have to contribute to the system. And I agree, everybody can contribute, and everybody should contribute one way or another. Then you will have to also to make sure that you do two things: not wasting money. Wasting money happens when you have 2 or 3 ministries overlooking the same social security institution, or worse, 2 different social security institutions that deliver overlapping services and not knowing from each other what they are doing. And so that's obvious where you can start. I think Benson is absolutely right, is that education maybe or training, capacity building is crucial, it's pivotal in this sense. And then an old lesson that I learned very early when looking at these systems is that, and then I come back to simplicity, is the more complex a system is, the more corruption you have. It's pretty simple, and it's pretty simple. If you have a complex system, the corruption will be huge. And so bringing down the complexity of a system also will reduce corruption, and will contribute to having the idea of a social contract that may work.
All right, thank you very much. Markus, what are some of the questions that our panelists should address from the audience?
Yeah, thank you, Esther. Well, we have got a lot of questions, and I think we are unable to raise all of them now. I would like to start with three ones at the beginning, and whoever feels like ready to answer them, please raise your hand. So the first is raised by Cher McClenaghan. How can we get more countries to appreciate the power of having broad-based, universal, benefit-tested, tax-financed life cycle income transfers like child benefits and old age pensions? So that's number one. And the second is raised by Armin Bauer. Did the COVID pandemic result in a new focus on social protection in a more systemic way? And the third at this point is by Daniel Horn. Is it not time for an enforceable international commitment to make floors adoptable by 2030?
All right, any volunteers? Veronika, do you want to pick up on any of the questions? Or Chris wants, okay. Chris, go ahead. And then followed by
I
Benson.
think, well, starting to answer the second and the third question without taking too much time, is that it's too early to tell whether governments start to use the COVID crisis. I mean, the COVID crisis is still going on. We may have in the global north the idea that the COVID crisis is almost over, which isn't the case. And it's full-fledged going on in Asia and some parts of Africa. So it's too early to make conclusions on that. But it doesn't mean that there's no thinking about that. We ourselves, we're working with ILO and with UNICEF in YAPRO in the East Asia and Pacific region, trying to understand what are the four things that are important. And our paper is almost finished. So I think the four things that are important are the universal mindset. Everybody can be at risk. And I think people are willing to buy that now. In the past, people were not willing to buy that because everybody thought that unemployment was something that would happen to others, not to them. Or becoming very ill where you have to stay at hospitals for months is something that happens to others, not to them. And all these kind of things. So that's the first thing. The second thing is that we try to do it in a systematic way. That means that we're systematically mapping what's going on and simplify where we can, looking for gaps, looking for the overlaps, filling the gaps and deconstructing the overlaps. Indonesia is a very good country where they did that. They simplified, for example, their in-kind transfer system to a cash system because it worked and it works better. Now they don't want to go back anymore. The third thing is to make it shock-proof. That means that we start thinking now today how we will react to other crises that will come. And these crises may come much more to low and middle income countries in the south when we talk about climate change, and they may come soon. And so we better think about what flooding will do, what a volcano eruption will do, what drought and heat waves will do to the economy, and how we're going to react to that within our social protection system. And the fourth thing, which I think is important and immediately also is a reference to the third question, is that yes, there should be an international debate about this, but I think not so much about the debate about what actually the systems have to do, but who's going to pay for them. And I think the mindset now is ready, and we make the point in the paper that we should do a couple of things. First of all these countries, including ourselves, all the countries across the world, have spent a lot more money the last 1.5 years than we ever spent on social protection before. This will have to be paid for. And I'm sure that already now the IMF, as in 83 of the 100, a little bit more, loans that they given to countries, there is already a conditionality in that austerity will come afterwards. Well, austerity usually means cutting down on the social sector. And I think what we should do internationally is making standards. I mean, the African Union made a standard, which is pretty simple. We all have to spend at least 15% of our GDP to health. That's good. So that means, let us make the agreement with the IMF and the World Bank. No country is going to cut on their health expenses unless it's above 15%. Below 15%, which is most low and middle income countries, you don't touch it. And we can do the same for the elements of the social protection floor. We can do the same for children. We can do the same for education. We can do the same for elderly. That would be a huge progress, because then governments will have to think about where we do get the money if it's not the social sector we cut. Thank you.
Thanks, Chris. Over to Benson. Oh, sorry.
No, sure, Benson.
Oh, okay. Is it me?
Yes, you raised your hand, so I thought.
Well, I did. Well, yeah, I was just, fascinated by the first question, alluding to concept of universal service provision, issues of entitlement in terms of social protection service provision. And the question was, how can this be actualized? But I can only speak probably on the context of Zambia, which I'm very familiar with. I very appreciating the challenge that we have. But I think in general speaking, if this universalism, entitlement is to be achieved in the context of Zambia, first thing first is to come up with a comprehensive social protection legislation. Because such a legislation does one thing: it guarantees the provision of social protection services, whether it's universal or not. But even if it's not universal, but at least it guarantees that this program will be in existence until such a time that when the nation as a whole decides to do away with them. So we need that first. And the other thing was they were talking about the concept of mindset to change, the conception of what social protection is. As that was mentioned earlier, there is a general belief that, especially among some of the economists, they look at social protection as another form of, unproductive consumption of services. And so then social protection services in terms of national budget allocation is far below. For instance, in Zambia, by 2015 or so, in terms of national budget allocation, social protection sector was only about 2% of the national expenditure. So that gives an idea of what the mindset is for those people that make decisions on where the national resources has to go. So there is an issue about, mindset, and that mindset needs to be clarified. The other thing, of course, is that even if you're going to create the universalism, there should be a system of monitoring who gets what and how much what person gets. And then it brings into the issue of the management information systems. Because, we can just say we provide universal, but it's difficult to tell who gets what and how and what do they get. So in the absence of some kind of a system of information that can help to monitor the provision of such person, maybe difficult to talk about universalism. But again, universalism should be tied to the national development, the national level of development. Because, entitlement means that people have to access, but is the national capacity in terms of national economy able to sustain that? Again, it's a question of being realistic. But if you work towards those lines of improving the national economy and, changing the mindset and putting in some legislation that can guarantee, probably that you can start to move towards the universalism. That's, I think, I can say for now for Zambia.
Thank you. Markus, shall we open up for a last round of question, or is there anything?
Very short one, yes.
Yeah.
I clustered 3 ones. The first, Sergio Buroyana, I hope this is somehow right pronunciation. Would you suggest to include traditionally informal social protection in the system, and how? And a question by Armin Bauer: how can the private sector be more and better involved in the delivery of social protection? Public procurement for social protection is mainly for government agencies and NGOs. Private sector might be a smarter way. And then a question that links a little bit, questions for Veronika. another question: why we neglected in the social handbook the traditional, informal, and private forms of social protection?
All right, maybe a question then for us. Okay, so who would like to take the question on the traditional social protection actors, Chris, and then the private sector? Garima or Veronika? Okay, good. Yeah, then we do a quick round and then Markus and me will be answerable. All right,
I would like
Chris.
to, yeah, on the informal social protection, I would like to make two simple statements. First of all, informal social protection is protection. People help each other, and in crisis, people survive because of the help of their family and their friends and their social network. So it's nonsense to ignore it as protection. But it's not considered social protection, because social protection, and that you heard from all the panelists here, is linked to rights and entitlement. And informal social protection never gives you a right to be helped, not by your brother, or your sister, or your parents, or your children, not by your social network, and so on. So only when there is a right to receive assistance when you need it, then you can talk about social protection. That spills over immediately also to the role of the private sector, which I think can be very beautiful, but within that principle, according to me.
All right, thank you. Veronika, what's your take?
I mean, I would like to build on that with the informal social protection and then come to the to the private sector. I mean, there was this example of Uganda where informal economy workers are organizing themselves to launch the social protection schemes for themselves. And of course, I mean, I wouldn't discourage that. I mean, in the absence of the state fulfilling its role, these are solutions that come up and are important. But as a state or government, this is not necessarily the way to go. I mean, these schemes often have a tendency to pull the weakest risks. So, I mean, you have bad risk pools in those. And that's the strength of national systems, that you pool across all levels of income and all risks. And you can include redistributive mechanisms through that. And the reason why we emphasize so much the importance of public solutions is what Chris already said, but also because I mean, normally to have these large risk pools and mixed risk pools, schemes need to be compulsory. And it's only the state through legislation that can create mandatory social insurance schemes that ideally then cover at least a very large part of the population with contributory capacities, and those that don't have contributory capacity, you need to figure out different solutions for. So that's one thought on these more informal schemes.
And now the private sector, maybe
on the role of the private sector.
Yes.
I'm going to come to this now. There's two things, but I mean, one is private insurance, and what I said before, I think already illustrated why private insurance, yes, I mean, those with very high incomes and that want to do additional voluntary private insurance, that's fine, but it's, I mean, it's, public insurance can have these redistributive mechanisms that are important, and it's only public insurance that does that. So that's the primary way to go. Of course, there's a huge role to play for the private sector in different steps along the delivery chain. And in a lot of countries, this is already the case, especially, for example, the payment providers. Payment providers in most countries, I think, are organized through the private sector. There's a lot of hype now around, for example, digital payments, e-wallets, mobile phone payments, where there's a very strong collaboration, obviously, with the private sector to deliver benefits through these channels. Also in terms of the entire, we haven't really talked a lot about all these different details of the delivery chain, but in the back end of the administration, ITC systems, information systems that you need to build, there's a huge involvement of the private sector there as well. And this is not without challenges, because obviously public procurement, it needs strong capacity in the public administration for good procurement processes to really purchase solutions that fit the needs, that avoid provider lock-in. And I mean, there's sometimes the balance of power between the private and the public sector, or of capacities also is a challenge. But yes, to keep it short, there is a role of the private sector. This needs to be carefully managed, and it needs to be under the overall supervision of the state. So even if the state contracts out or purchases certain services to the private sector, it's still the state or the government that ultimately is responsible for providing adequate social protection to the population.
All right, and I can see that Markus has already uploaded his presentation, so I'm really sorry. I think we have to stop here because we also want to, of course, leave some time to discuss what is in the handbook and what is not, and just give you a brief overview, get you interested, and also talk a bit about the multimedia app. Maybe just to quickly respond to the question, it's maybe the informal sector and the private sector are not as, let's say, highlighted in the section on instruments, but it is covered in the handbook. We talk about the different roles in the chapter on actors. I think in the chapter, Markus' chapter on microinsurance, there's also mention of it. And also, of course, in the introduction chapter, we also provide a more comprehensive overview of the different actors and who is actually in and what role they play. But now over to Markus to guide us a bit through the handbook. And thank you very much, of course, to all the panelists for your answers, and also to the audience for your interesting questions.
Thank you very much, Esther. Yeah, we want to finish in time with this event. Therefore, I would like to say a few words on the Handbook on Social Protection Systems. I hope you can all see the slides. So the Handbook provides a comprehensive overview of many instruments, actors, and design features of social protection systems, as well as their application and impacts in practice. It is very important for us to stress that we try to combine academic discussion with very concrete empirical cases from the global South and the global North. Of course, the book centers around system building, harmonization across programs and delivery mechanisms. And most of all, we would like to stress that it is really meant to address all three groups of readers: academics, students, and practitioners. So this is the contents of the handbook. So it starts with an introduction, then it provides an overview on the main questions, the main issues of system design, such as targeting, such as conditioning, such as financing, and so on. It looks at some of the most important instruments of social protection. It looks at specific target groups, such as children, such as refugees, and so on. It looks at administrative and delivery issues, and here very much we look at this question of the systems approach. It looks also specifically on policy coordination. There is also one section on the effects of social protection. So what evidence do we have for the effects on poverty, inequality, hunger, but also social cohesion and economic development? And finally, of course, there's also a whole section on political economy issues and possible challenges for social protection. So I don't want to read out all this, but the handbook calls for a more systemic approach, of course, which means for us, that's the conclusion, that social protection systems should be as universal as possible, or at least start and focus on the poorest. They should be better synchronized and coordinated. They should differentiate between the beneficiary groups if there is a need, taking the specific needs and challenges into consideration. Social protection should be seen as a key component of social contracts. So they should be seen as a part of a give and take between the government and society, where the give of society is legitimization of the government, and the give of the government is, among others, social protection. Apart from that, each country must decide itself on the mix of social protection systems. So the two main pillars of social protection in the handbook are social transfers, of course, and social insurance. But in addition to that, we have chapters on social services, such as rehabilitation for handicapped people, labor market policies, and microinsurance. But we also look at the links to other policy fields, such as graduation, humanitarian aid, and taxation. As I said, one part of the handbook looks at the effects of social protection systems and tries to show that social protection is a key ingredient, a key instrument for the achievement of many of the Sustainable Development Goals. So there's one chapter looking at the effects on SDG 1 and 2, poverty and inequalities, another one at SDG 2, zero hunger, another one at SDG 3, good health and well-being, another one on gender, and there's other chapters looking at the effect on economic development, on international cooperation, so social protection being a key topic in international cooperation. There's one chapter looking at the possibilities to use social protection as adaptive social protection instruments, so helping people to adapt to climate change. And of course, there's a chapter looking at the effects of social protection on social cohesion. But we also look at the possible challenges that for social protection. So what does demographic change mean for social protection programs, and how can they be made? How can they be designed to make them resilient against negative effects of demographic change? There's one chapter on pandemics with a concrete example of the COVID-19 pandemic. There's one chapter looking at digitization and automation and its effects, possible effects on the world of labor, and what social protection can do about it. There's one looking at climate change, and there's one chapter looking at the effects of globalization in general. The handbook has 43 chapters on topics plus 18 case studies. These chapters and case studies have been written by 67 authors from 22 countries in 5 world regions. So this is a map of the case studies that we have included in the handbook. And for us, what we are really proud of is that the handbook comes in 3 versions. There's a book that you can buy in a bookshop. And this is just 2 pages from the handbook, and we really think that the format of it is very nice and easy to read. Plus there is a free global access online format of the handbook. You can download all the chapters from the Edward Olger online page for free. And finally, of course, there's also a multimedia version of the handbook that we will introduce to you in a minute after this presentation. And it is also freely accessible by mobile phones and by computers. So this is a picture of most of our authors, and we would really like to take this opportunity to extend a very, very, very strong thanks to all the authors. I think I can't name all of them, but I would like to mention at least those who have really helped us very, very much in co-editing some of the sections of the book. That's Valentina Barker, Christoph Hagemeyer, Christe Neubourg, whom we had with us today, Daniele Malerba, and Francesco Borchi. Thank you very much, the 5 of you, but thank you very much also all the other authors. Without you, we would not have been able to produce this large book. And we would like to extend thanks to our home organizations, the German Development Institute and the Bonn Rhein-Sieg University of Applied Sciences for their strong support in terms of giving us the time resources and providing us with funding for the production of this handbook. In addition, we would like to thank especially the GIZ, the German international cooperation, which has, with the support of the BMZ, the Federal Ministry for Economic Cooperation and Development, supported a substantial financial support for the production of the handbook and for making the global access free of charge. We would like to thank Litello, which has produced the multimedia version and really done a lot, contributed a lot from their side to the making of this handbook. And finally, of course, also Edward Elgar. So I think, so these are the links to the free global access version. I've also typed them into the chat. And to the multimedia version, I would like to thank you very much for your attention. And now we would like to show you a small clip introducing you to the multimedia version.
There's also a multimedia version of the Handbook on Social Protection System that is created by Litello. On the landing page, you will find a video of Esther and Markus Loewe introducing the book. And next, you see the book in numbers. Most importantly, there are videos in this multimedia version. There are also 3 expert voices, as well as a student video created by the students of the Master on Social Protection Systems at the University of Applied Science, Bonn Rhein-Sieg. The table of contents shows an overview of each part with a quick introductory sentence and then a video by the section head. Lastly, on the landing page, you will find a quick overview of the 2 editors, Esther and Markus Loewe, and the contributor team. If you are now interested in the Multimedia Handbook, please send an email to register@litello.com. An account will then be created for the sender email address. That's for free, as well as access to the book. You can either use the web reader or the Litello app. I'm using the web reader right now, and if you go further down, you can see the handbook. You get directly to the first chapter. You navigate by pressing the arrow. It then leads you to one of the key features of the multimedia version. The 3 key facts that summarize the content of the chapter or the case study. The next unique feature is the quiz chapter that is at the beginning of each chapter and case study, where you can test your knowledge. The next important feature is the highlight. It highlights the most important sentences of the chapter, and you will find them throughout the whole chapter. Throughout the book, you will find some videos like this animated one to further expand and give a visual representation of a topic. By clicking at the top bar, you will see the table of contents folding out. Unique to the web reader is a search bar. If we, for example, look for social transfers, it leads us right to either the table of contents or the chapter itself, but also any other point in the book where it mentions social transfers. It's also possible to highlight sentences on your own. You can choose different colors, and you can also write private notes. At the end of each chapter, you're going to find concluding remarks and also points for discussion to engage further with the topic.
All right, this was just a brief introduction to the multimedia version, which is yet to come. So you can register if you're interested. You can, of course, also register at a later point. We expect the multimedia version to be ready by the beginning of October. All right, are there any last-minute questions from the audience concerning the book or also the multimedia version?
If there's no question right now, I quote a question that was asked during the discussion by Irene Among. She asks Sigrid Kühlke. I wonder if you plan to include a broader version of the SP across human development nexus in the near future, notably on the links between humanitarian health and so on. So I try to answer this question more broadly. We are planning to update the handbook every now and then. So all authors are called to check themselves if they would like to add something to their chapters. We might approach them. We might even add new articles into at least the multimedia version of the handbook in order to keep it a living document. And questions like this, of course, are most welcome to be included in the next version, perhaps not during the next 12 months, but afterwards we will check additional issues. And if you have a really good idea like that one, please be with us, get back to us, and we might extend the handbook.
Yes, and also this concerns other features. I mean, you've already seen that there are additional videos that we produce, smaller podcasts, and sort of also videos on different themes. So this is also, of course, another potential area that we can expand. So if there are new topics that come in, of course, we can also enrich the multimedia version across time. And a big thank, of course, not only to the authors, but also to those that contributed to the multimedia version. We have to say all our interview partners. And so thanks a lot for that as well. Yeah, so if there are no further questions, then of course we can only extend a big thank you once more to the panelists, to the audience, and thanks a lot for your interest and the engaging questions. And thanks, of course, one more time to socialprotection.org. We will respond to any of the questions that we've not managed to answer yet. And of course, we will also be available in case any further questions come up now after the event or tomorrow or in the next days. You got our email addresses, so please feel free to contact us and follow up. All right. Bye-bye.
Bye, thanks for organizing this.
Bye-bye.
Bye. Thank you for organizing.